Hi everybody, Dr. Cary Yurkiw here. I'm a chiropractor in Kelowna, and today we're going to talk about whiplash. As the weather turns colder, it gets snowy and icy, the driving conditions change and sometimes people don't adjust. And I've seen many accidents in the last day or two here in Kelowna where people have gone through intersections, there's a lot of rear enders, and we're going to talk about the effects of car accidents on the body and how we go about treating whiplash and conditions related to car accidents. Now, whiplash is something that we see in the clinic on a regular basis, and it's because the head gets whipped back and forth, as well as the back can be injured, even the wrist and the elbow. And I'm going to cover different injuries that I see in the clinic and then how I go about treating that to resolve the injury sustained in a car accident. I've been practicing chiropractic for 30 years now, and I've treated thousands of patients in the clinic, as well as hundreds of people that have had whiplash. So whiplash is a common condition that we see, and the approach that I use in the clinic is a hands-on approach, instrument adjusting, shockwave and laser, and the goal is to restore the normal alignment and the function of the joints. It's best if the immediately after, because it's easier to treat. People will wait as the symptoms are getting worse, and that's been for 7 hours. Generally get worse out at all, and the sooner we can start treating, better, because if it is delayed, it can take longer to correct the problem. And whiplash is defined as a neck injury that can cause pain and stiffness in the neck, as well as radiating pain in other areas of the body. For example, when you have whiplash, the pain can radiate down into the shoulders or even down the arms through the brachial nerves right to the tips of the fingers. Also, injuries can occur from the shoulder strap, and that can affect the shoulder itself, the ball and socket, the clavicle, so the AC joint in the shoulder, as well as the rotator cuff can be affected. The upper back can be affected, the arms, or even the wrist. And last year, I had a lady that just had a wrist injury from a car accident. She was holding onto the steering wheel. She was hit from the side. She gripped the steering wheel really hard. It injured her wrist, and that's what required treatment. And I used a combination of chiropractic adjustments and laser successfully to treat her condition. There's other causes for whiplash, in addition to car accidents, like sports injuries and sometimes physical abuse can cause whiplash-like effects. When you come into the clinic, we do a history, find out more about the mechanism of injury. And then what we do is an assessment. And the assessment involves checking the spine and the joints. And we do that by examination, and that involves flexion and extension, rotation, lateral bending, so the ranges of motion of the affected joint, and then palpation to feel the alignment of the joint, if there's any swelling in the area, muscle tightness, any point tenderness, which gives us clues as to the extent of the injuries. Sometimes we'll take x-rays to find out if there's any damage to the joint. And then what we want to do is treatment to restore the alignment and range of motion of the affected areas. The treatment can involve hands-on adjustments, so that's traditional chiropractic care, but also instrument adjustments. I use the activator and the integrator, newer techniques in chiropractic to do adjustments, as well as technologies like shockwave and laser. Shockwave being acoustic or sound waves that go into the body to break down scar tissue and heal the joint, and laser being light therapy that does the same thing. These techniques reduce pain and disability and facilitate the healing process. Sometimes I'll recommend ice or heat depending on the stage of care we're in. as well as postural supports like a neck collar, a back support, a proper pillow, those types of devices that can help maintain good posture and relieve pressure on the nerves so the person feels better. Here's a couple testimonials of patients that came into the clinic and got help. This lady, Veronica, was in a car accident and had whiplash. Dr. Yurkiw was able to get me back to my normal self. He's knowledgeable and professional. I would highly recommend him to anyone needing chiropractic care. And then Jason, Dr. Yurkiw helped me greatly for my back. I was referred to him from another chiropractor in Kelowna because I live in Penticton, and that's when my practice was in Penticton for 10 years. Now I'm in Kelowna. I have scoliosis. Also, I had gotten into a car accident and got minor whiplash. Dr. Yurkiw has helped me a great deal with my back. For contact numbers, the first one I'm going to give you is for ICBC, and that's here in British Columbia. So you want to call 1-800-910-4222, and that's the claim line number. And then you want to get a personal injury claim number. So basically they'll assign you a number, and that's your account number when you come into the clinic. You're automatically approved for 25 visits in the first 12 weeks after the accident. So the sooner you start, the better. I've seen some patients start after a few weeks, and then they still have the 12-week cutoff, so it can be difficult to get all the sessions in 12 weeks. Then we have to ask for an extension. So the sooner you come in, the better. And everyone that's involved in the car accident is covered. So whether you're at fault or not, whether there were several members in the car, even if there was a car that hit a bicycle, let's say, the bicyclist is covered through ICBC. So, or a pedestrian would be covered. So there's coverage for everyone involved to get them back to pre-accident status. You just have to bring the claim number into the clinic, and then what we'll do is check the number and start billing ICBC directly. There may be some small co-payments involved depending on the coverage that ICBC has or you have with your insurance company. So ICBC will cover a majority of the cost of the care here in the clinic. Now, for our contact number, our phone number 250-486-0062, you can go to tuttstreetfamilychiropractic.com to book an appointment as well. So you can call us or message us at this number, or go directly on our website and book an appointment. When you do, just indicate it's an initial visit. We'll send you a paperwork link, and in the paperwork link where it says insurance, just put down ICBC and put your claim number in so we can check the insurance coverage for you before you come in. We're located at 406-2755 Tutt Street, so on the 4th floor, unit 406, 2755 Tutt Street. That's close to Raymer here in Kelowna. And usually you can get a same or a next day appointment. We are open 7 days a week. You don't need a doctor referral to come and see us. So it's very user-friendly to get into the clinic and get care. Sometimes people have questions. We'd be happy to answer those for you. Questions like, do the adjustments hurt? What should I be doing to help myself? Sometimes they need a note for the employer, or they need to modify their activities. All of that is something that we discuss with our patients. So no problem there. We'll be able to help you with that. And I look forward to seeing you soon.